The final phase of the research process is the stage where all your efforts finally come together. After collecting, analyzing, and interpreting your data, it is time to communicate and translate your findings. This means sharing your results with others and applying them in nursing practice to make a real impact. This phase ensures that your research contributes to knowledge, policy, and patient care improvement. Remember, research is only as valuable as its ability to improve lives and transform nursing practice. Research communication is the process of sharing your research results with various stakeholders, such as fellow nurses, educators, administrators, policymakers, and the public in general. It involves clear, accurate, and ethical presentation of your findings so that others can understand and use them properly. In simpler terms, it is how we tell the story of our research, what we did, what we found, and why it matters. Effective communication promotes understanding, collaboration, and knowledge utilization. For example, sharing your findings in a hospital meeting might lead to a new policy or practice guideline that benefits patients. Sharing results is only the beginning. The next step is to translate them into action. Research translation means putting research into practice. In the process of converting findings into real world application, that is research translation. This is applying our findings in schools, colleges, hospital protocols, clinical guidelines, health education programs, and in our nursing interventions. This step bridges the gap between research evidence and clinical decision making. Without translation, research remains on paper. With translation, it transforms our practice. Communicating and translating findings are important because number one, they strengthen evidence based nursing practice. Nurses make decisions not just from experience, but from solid evidence. These communication and translation of research findings improve the quality of care and health outcomes. Ultimately, patients benefit when nurses apply proven interventions. These also encourage nurses to become active knowledge users and findings disseminators. For instance, when we share successful strategies, it usually leads to better hospital protocols. Communicating research findings has several goals. First is to inform others about new knowledge, innovations, or best practices that can enhance care. Another one is to inspire replication for further studies. Other researchers may build upon your findings to strengthen the body of nursing knowledge. It is also to influence policy, education, and clinical practice. Your findings can guide curriculum updates, community health programs, or government health initiative. Communication allows research to create a ripple effect, from classrooms to hospitals to national policies. There are ways to share research findings. First are written reports, such as theses, manuscripts, or journal articles. These are formal and detailed. We have the oral presentations, like seminars, conferences, or thesis defenses, where you present key points to an audience. And then we have digital dissemination. This includes online platforms like the social media, infographics, or webinars, allowing for a wider reach. Each of these forms has the same goal: to make your research accessible, meaningful to those who can use it. A research report is an organized presentation of your entire study from beginning to end. In our institution, we must follow the IMRAD format. IMRAD stands for Introduction, which means what the study is about and why it is important, the methods, how you conducted the research, the results, what you discovered, and the discussion, what those findings mean and how they relate to existing knowledge. The report must be clear, concise, and objective. Avoid emotional or subjective language. Your goal is to present facts that others can verify or replicate. To make your report strong and credible, follow these writing guidelines. Use formal and scientific language. Avoid slang or overly casual phrasing. Present accurate and complete data. Double check figures and sources. Include tables, figures, and appendices to enhance clarity and visualization. Always acknowledge all sources and contributors to uphold academic integrity. A well written report reflects professionalism and honesty, two qualities that every nurse researcher must uphold. When doing an oral presentation, remember that your goal is to summarize your key results clearly and confidently. Here are a few tips. Focus on the highlights. These are the most important findings and implications. Use visual aids, such as PowerPoint slides or posters, to make data easier to grasp. Be ready to answer questions and defend your interpretations logically. During your research defense or in conferences, remember that clarity, confidence, and credibility are your best tools. In this digital age, presentations have expanded beyond classrooms. This includes visual and digital dissemination, which makes your research more accessible and engaging. Use visuals like charts, graphs, and infographics to summarize findings quickly. Leverage platforms such as webinars, podcasts, or social media posts to reach a broader audience. This includes healthcare professionals and the community. However, make sure all content is accurate, ethical, and appropriate for your audience. In translating research into practice, this means integrating your findings into real life settings such as hospitals, colleges, or communities. Incorporate findings into clinical guidelines and protocols. Apply results in nursing education or community health programs. And collaborate with health agencies and policymakers to implement change. This is how research directly enhances nursing care and health outcomes. However, translating research into practice is not always easy. There are several barriers. Common barriers include limited access to research or lack of awareness. Some nurses don't have access to journals or do not have time to read studies. Then we have organizational resistance to change. Institutions may prefer traditional methods over new practices. And then we have inadequate training in evidence based practice among staff nurses. And then we have poor communication between researchers and practitioners. Recognizing these barriers also help us develop strategies to overcome them. To make sure your research findings are actually used, we conduct training sessions and dissemination workshops to share results. We also develop policies or policy briefs or clinical guidelines that summarize practical recommendations. We can also strengthen the research practice partnerships through mentoring and collaboration. And we encourage institutional support like management endorsement and budget allocation for implementation. Research has no impact if it stays in a folder. It only matters when it changes practice. While communicating and translating research, we must uphold the highest ethical standards. In all forms of dissemination, ensure accuracy and honesty in reporting results. Give proper credit to all contributors and participants. Protect confidentiality. Never disclose identifying information. And avoid plagiarism or distortion of results. Ethical dissemination strengthens the credibility of nursing research and protects the dignity of participants. Now, let us talk about the vital role of nurse researchers in this process. The nurse researcher acts as a communicator by sharing findings effectively across platforms, as an educator by guiding others in understanding and applying evidence, and a change agent, which is promoting innovations that improve care outcomes. Nurse researchers also advocate for research informed policies in healthcare institutions and communities. Through their work, they help bridge the gap between science and service. In summary, we have discussed that communication and translation extend the impact of research. Effective dissemination ensures that findings reach those who can use them. And nurse researchers play a central role in applying knowledge to real world settings. Remember, a study only becomes meaningful when it improves people's lives. As nurses and researchers, let us commit to share our discoveries and transform them into action that benefit our patients, our communities, and the overall nursing profession.